One Zambia, One Nation. Welcome to Zanis News. I'm Alice Banda, your presenter. The headlines. Health sector records positives in 2023. Constituency development funds utilized prudently. And government to construct 28 dams across the country. The news in detail. As we review the year 2023, we begin with the health sector. Government scored tremendous strides in the health sector in ensuring that all medical facilities are stocked with essential drugs. The Zambia Medicines and Medical Supplies Agency, ZAMSA, procured 42,000 medical center kits for primary health care services from Mission Pharma in India, as well as bulk medical supplies for tertiary and secondary health facilities from Egypt. Petia Simtale now reports.
The year 2023 will be remembered as the period in which the government, through the Zambia Medicine and Medical Supplies Agency, ZAMSA, heightened efforts to ensure equitable distribution of medical supplies in health facilities across the country, especially health center kits and other products.
ZAMSA has also awarded long-term framework contracts for renal, laboratory commodities, essential medicines, and medical supplies to avert stocking out of key commodities due to procurement processes.
This has seen the number of community members going to receive professional medical health care increased. This is also the year in which government employed 3,000 health workers, adding to the 13,000 that were recruited in 2022, a significant step towards enhancing the country's health care capacity.
Moreover, to promote inclusiveness in healthcare, the Ministry of Health has introduced basic sign language in nursing and midwifery curriculum. This ensures that nurses and midwives have basic sign language skills to communicate effectively with clients who have communication challenges in healthcare facilities.
A check at most health institutions across the country by Zanis revealed presence of essential medicines in pharmacies and health workers attending to patients.
The amendments, we hope that in 2024, most of the things we are supposed to procure, we'll be able to procure them in the first half of 2024.
For sure, the year 2023 has gone, but it will never be forgotten as many milestones in the health sector were recorded. Petia Simutale for Zanis News.
Still on health matters, the Kasama District Health Office has formed an epidemic preparedness committee to help combat cholera and other epidemics in the area. District Health Director for Technical Services, Charles Chongu, says the committee has put in place measures such as stocking up of essential medicines to combat any disease outbreaks. Dr. Chongu says the district has also devised preventive measures through the Health Promotion Office, which is engaging the public on ways to enhance hygiene and sanitation standards. Meanwhile, Kasama Mayor Teresa Kolala has urged the residents to maintain high levels of hygiene to prevent diarrheal diseases.
We have formed the Epidemic Preparedness Committee, which is overseeing our response to epidemics, including cholera. So as a district, we've been prepared right from day one. We are putting measures to ensure that we are ready should we have a case, but most importantly, we are working towards preventing having any case in the district. So the Health Promotion Department is on the ground engaging the community on ensuring that hygiene and issues of sanitation are enhanced. We are also pre-positioning ourselves in ensuring that the supplies we need, for example, fluids, the test kits and everything else, antibiotics are in place. And we are also making sure that we pull together all the departments that contribute to the well-being of the community in the district to ensure that we are on top of things in terms of prevention.
There are very high levels of cleanliness in the hospitals. I'm sure that you would agree with me that every hospital that we went to, there is no trace of even a smell of any kind in these hospitals. So I commend the hospital administration for a job well done, and they should just continue to keep clean, and also an appeal even to the residents of Kasama to say rainy season is at its peak this time around, and we don't want to also fall prey to cholera.
Meanwhile, in Western Province, Lewanika General Hospital Principal Nursing Officer Tandiwe Lubasi has advised expectant mothers to desist from giving birth from home. Ms. Lubasi says the hospital has received cases of mothers who give birth from their homes and are only rushed to the hospital when there is a complication. She was speaking when Mongu Mayor Nyambe Muyumbana visited the hospital to present baby hampers. We take our first break. When we return, constituency development funds utilized prudently.
Hena korera ninzi, korera bulwazi bwa kusomona. Imuntu ugiswa bulwazi bwa korera ulasomona kuluka kapati. Itubi tulamenda menda manji. Imulwazi ulawanyota kapati agambwa kumana kwa menda mubiri. Imulwazi iwa korera unga wahwa umawola alo ali 12 gombo kutita jana busirisi buli kaboto. Hena munzira iri buti muntu bwahwa yakujana bulwazi bwa korera. Igunywa menda alo atabikibyo musamu ja tuzunda na menda aje sitombe. Igurya jagurya jalo igubere hamanza atasahigwa igabuto na igubere hamitima na himwi yalo atasahigwa amimusamu na mwamenda ajisi imusamu walo ja tuzunda. Igurya jagurya jitawunigidwe jalo jakarwa nzinini. Igurya jagurya jitontola jalo jalegekwa na jajiro yalo jenero tija oburuga buto. Igurya jagurya jamumazira. Igurya imijelo na jihumani jalo jatasahigwa gabuto. Hena munzira iri buti muntu mbwa yahugwa bira bulwazi bwa korera. Igubona masimpe guti wabagwananganya gabuto menda agunywa. Igwinda mugubona masimpe guti ajigwa na igubiko musamu wa chlorine. Amusambe mumanze nugubere hansipa. Na menda abigwe musamu ja tuzunda mwamana kubere haje mbuzi amugisibige nango jigasaha ija kurya gamutana agujirya amuhunige ija kurya jindi yonse igutegwa guti gitakarwe nzinini mutari ija kurya jagura mu mazira amuberehe ija mbuzi jindi yonse amuritantamune mugubere hayigumbuli na tupepa rwa plastic mugusowa tubi ambone masimpe kuti tubi twasogwa na igubikwa mu mbuzi ambone masimpe kuti jimbuzi jindi yonse gajisalala na gajihunigidwe oyimulumbe waletwa kulindunye abamutabulanganya nseba mu gisi.
Welcome back. We continue with our review of 2023, and we now take you to Mchinga Province, where the local authority in Lavushimanda district has erected modern offices using the constituency development funds. The district has also been provided with a maternity annex, among other projects. Lakson Makosa was in the province and brought us this report.
The Constituency Development Fund CDF-funded projects have changed the outlook of Lavushimanda district in Mchinga Province. Among the structures that have raised the profile of the district is the construction of new council offices, maternity annex, and a mortuary. Lavushimanda Town Council Secretary Dominic Makisa says CDF-supported projects have enhanced the outlook of Lavushimanda. Mr. Makisa cited the construction of the first ever modern council offices under the CDF as one project that has raised the profile of the district.
Assist to enhance coordination of the devolved staff because we will be housed in one place and coordinating the devolved, seeing to it that programs that need to be implemented, it will be easy. It will be easy, unlike in the past, because these devolved were adopted from various places.
The coming of the new council building is also expected to create job opportunities for the locals.
Kwena okuleta kwa ichi chikulwa kwena nachetekera okutsira chitwara kwatira mweshuko pantu pamulando nokwebati era twara ingira kwenchito pano turebomba kuna abana besu bagala kwati okusekeramu.
Another major structure that is above 98% completion is the construction of the maternity annex at Salamo Health Post.
Looking at the government directive, the presidential directive, and the urgency and the need that the community has, we looked at the distances that they're having to travel for deliveries and trying to avoid those fatalities. So we decided to do a maternity annex at Salamo.
The community of Salamo is happy with the construction of the maternity annex. Apart from infrastructure development, the CDF bursaries have also helped vulnerable families send their children to school.
Kwamba grade 11 kwena bali msupport omwana through CDF. So nishali pofena nguni wanungwe kwena omwana ale afye bwino nokubwera paka neopo apwisha ino ali pusha grade 12 ali lemba. Na mfema out yakwe yalesa fya asuma bwino sana. So ubuteko bwena ndetotera utwalirire.
With the right use of the CDF, communities and individuals are being impacted, with livelihoods being transformed. For Zanis, I'm Lakson Makodza.
And in Eastern Province, the Lundazi Town Council has drilled about 20 boreholes using the constituency development funds at a cost of 1.1 million kwacha to help increase access to safe and clean drinking water in 10 wards of the district. District Council Chairperson Gordon Tembo says the provision of water points is as a result of inadequate water supply. Luwase Mutafela brings us this report.
Access to safe and clean drinking water in rural communities have remained a challenge due to lack of water supply infrastructure. To address the situation, the Lundazi Town Council is using the Constituency Development Fund to sink boreholes, and so far 20 water points have been provided in 10 wards.
Each ward is actually receiving about 2 boreholes. So where we are here, this is Chimalilo ward, and it has also received 2 boreholes. So the total amount of the 20 boreholes that we are drilling in Lundazi district is about 1.1 million. So we're excited because water has been a challenge. Our people have been drinking water which is not safe from wells and so on, but now they're able to drink clean, safe water using the boreholes that have been drilled from CDF funds. So we are very grateful to the government and to the president.
Council under 2022 CDF, we've managed to do 20 boreholes. And again, under 2023 CDF, we are doing 10 boreholes, and we are doing again 3 water recirculation systems. One of the water recirculation systems that are being installed is going towards Chintuta Hospital.
Communities in Mwase have also benefited.
Kasuzikanga lazima wakamwanga kudrao liruko kunena huko kwene sono muwafikira maji aga ngawe mshomene fuka kupambana na padrao pakuwa vindu vinandi kwene hapa paboho hapa palije shingoni chilichose chishinga njira mkatu muyayi
isenso okondwa chomene mu maji aya ali kuzira tikatekanga kutali kuruko kudrao kwene sono titekenge pafupi icho nchikondwa chiwe mchomene.
Luwase Mutafela, Zanis, Lundazi District, Eastern Province.
Still on reviewing of 2023, the construction of the Kafue main police station at a cost of over 2 million kwacha was one of the highlights of the Constituency Development Fund's success stories. Residents feel a sense of enhanced security following the construction of the facility.
The Enhanced Constituency Development Fund, CDF, has proved to be a game changer for citizens of the country. A case in point is the construction of Kafue Main Police Station at a cost of 2.4 million kwacha, which was one of the highlights of CDF projects in 2023. Residents are happy with the construction of the main police station, saying there has been improvement in service delivery.
Yeah, actually this place is a nice place. This is my second visit, so comparing at the old, this place I liked it. We can just thank the government because it seems they are doing their works At least we have seen a lot of change in towns, different towns, not just Kafue.
Others expressed satisfaction with the upgrade in the standards from the previous structure.
Tonga ziko pali pamene ichita boma yeve isebenza polisi yeve ya this time awe ioneka bwino lomukati pametingera kuona abantu batu muri clean pali different paoneka bwino ni kulumushe yonse ma services ye yachitikawe tionga zikomo kuli boma yasebenza yeve
na baija ngu odi police station ija kwenza opezeka kuti enze ingono then uingono yakona enze libeko na malaiti kwa kuopereka abantu loko alakwa kwenza opezeka kuti kuli black kulibe na malaiti so at least yuko ini ikulu.
And the Kafue District Commissioner says the main police station has motivated officers to enhance security in the district.
With the coming of the new police station, there's motivation to our police officers. The environment is conducive, right for the task. Yes, I think we expect a lot good from them.
Clearly, Kafue main police station is a greater improvement in comparison with the older structure and has definitely elated the people of Kafue. Mtalekani for Zanis News in Kafue, Lusaka Province.
Also in the news, fish farmers on Chilubi Island in Northern Province are appealing to the government to provide them with fingerlings as a method of curbing illegal fishing on Lake Bangolo. Over 70% of people are engaged in fish farming activities, which is mainly done on a large scale in the region. We take our second break. Up ahead, government to construct 28 dams across the country. Stay tuned.
Kodi kolera ndi chani? Kolera ndi matenda othulula. Munthu amene adwala matenda ya kolera amathulula kwambiri ndi kusanza. Dothi lake limakhala ngati madzi momwe atsukira mpunga. Ndipo munthu odwala kolera madzi mthupi lake amatha kamba kakuti iye amachoka kwambiri kupyolera mkusanza ndi kuthulula kwambiri. Munthu odwala kolera angamwalire m'maola 12 kaya kuti 12 hours ngati sanalandire mwamsanga thandizo la mankhwala. Kodi munthu angatengere motani matenda a kolera? Kumwa madzi adothi, kudya zakudya ndi m'manja mosasamba mwadothi kapena kugwiritsa ntchito mbale zotsukiwa ndi madzi adothi. Kudya zakudya zimene zinangosiwa mosasamala posabwinikira. Kudya zakudya zozizira zachimbala zimene sizinasungiwa bwino. Kudya zakudya zimene amagulitsa mphepete mwa misewu. Kudya zipatso ndi ndiwo zamasamba zosatsuka. Kodi kolera ingachinjiriziwe? Gadusani madzi anu akumwa kapena kugwiritsa ntchito chlorine. Sambani m'manja ndi madzi aukhondo ndi sopo mukamaliza kugwiritsa ntchito chimbudzi. Funditsani zakudya mukalibe kuyamba kudya. Osadya zakudya zimene zimagulitsiwa mphepete mwa misewu. Muyenera kubwinikira zakudya kuopetsa kuti ntchentche zingakakeko. Nthawi zonse muyenera kugwiritsa ntchito chimbudzi. Pewani kugwiritsa ntchito machemba kapena maplastiki ngati chimbudzi. Onani kuti dothi litayiwa mchimbudzi. Nthawi zonse onani kuti zimbuzi zikhala zaukhondo ndipo nthawi zonse pambowa wa chimbudzi chanu pazikhala pobwinikira bwinobwino. Okubweretsani uthenga uyu ndi aunduna wa zaumoyo.
Zanis News continues. Government is set to construct 28 dams across the country at a total cost of over 100 million kwacha. Minister of Water Development and Sanitation Permanent Secretary Joe Kalusa says the dams will be constructed in climate-prone provinces. Mr. Kalusa notes that the construction of the dams will be implemented using funds from the 2024 budget allocation and also through cooperating partners. The PA states that the construction of the 28 dams will complement the already existing 16 dams, which are currently being rehabilitated and constructed in southern and eastern provinces. Mr. Kalusa further states that the Zambia National Services and some private companies are the contractors of the 16 dams, adding that so far the contractors are doing a commendable job and are on schedule.
In the 2022-2023 budget,
we had planned to construct 11 new dams and then rehabilitate 6 dams. That project is still underway as we are constructing most of them in eastern, southern, and central province, which are hardly hit by climate change. Those areas where we have been experiencing floods, this is where we are putting those 16 dams. And then we have gone ahead also. For this year, we have planned to do 28 more dams. So we'll be procuring the construction of 28 dams, which will be done this year through to next year, 2025. So the issue of water harvesting is very much on our cards. In the 2024 budget, we have put a bigger chunk of our budgets towards the water infrastructure or the water harvesting infrastructure.
In Central Province, chiefs in Central Province have reaffirmed their dedication to fostering collaboration and the effective implementation of the enacted Children's Code Act number 12 of 2022. 29 chiefs from all the 10 districts in the region have vowed to fight early marriages in their areas of jurisdiction by uprooting harmful cultural practices that promote the vice. Also in the news, service providers and other stakeholders involved in the fight against gender-based violence in Luapula Province have resolved to intensify work as multidisciplinary teams for GBV survivors. The resolution follows a training that has been conducted by the Zambia Center for Communications program.
The Zambia Center for Communication Programs, ZCCP Kwato, has embarked on the establishment of multidisciplinary teams whose mandate is to offer comprehensive care to gender-based violence GBV survivors in the districts of Luapula Province. ZCCP Kwato has since trained and certified members of the multidisciplinary teams with support from the United States Agency for International Development, USAID, under the Stop GBV Now project. Among those in the teams are GBV service providers such as the Ministry of Health, Education, Community Development and Social Services, Information and Media, the Zambia Police, among others. USAID Stop GBV Now project chief of party, Dr. Jonathan Kaunda, says the training will help stakeholders improve efficiency, accuracy and reporting, thereby reducing trauma in GBV survivors.
So this workshop is an entry workshop so that we can bring together different multidisciplinary people to come and first understand the baseline of how GBV has been managed in Luapula Province, because we are coming to Luapula Province for the first time. And once we've understood the magnitude of the problem, map out the strategies on how we are going to manage GBV. So it's basically an exchange of information, and this is why you have seen that even the setup is not that of a lecture setup, but discussion.
Facilitators at the just ended training workshop shared their areas of training.
Any of the survivors that come with life-threatening wounds, life-threatening conditions are supposed to be treated before their life is in danger. And not only do we offer treatment, we also offer expertise in the collection of medical evidence and forensic evidence to these survivors that come.
Most of officers that work under victim support unit, they are plain-clothed officers. This is with a reason that they create good relationship with members of the public, because members of the public, they do fear a police uniform. So for us to interact with them freely, we have to be in plain like they are, so that they can trust us and share information.
For the participants, the workshop has been fulfilling.
Continuity and sustainability of the same activities that we have started under that campaign.
For Zanis TV, Godfrey Chikumbi reporting in Mansa.
We take our final break. When we return, community health volunteers undergo training. Stay with us.
kolera wapa msongo muka. Kolera wapa msongo wa kuichisa. Mutu alina msongo wa kolera kuichisa nga chikuma na kusaza nawa. Bize vipi mwaichisa mutu na vipoya meya nge msoji wa loso. Mubeji kuzia chikuma mujimba mumo ya kufumisa meya a mujimba. Mubeji nawa na hase kufa mujola li 12 hours ngeka kumuhana vitumbo vya kumuka wa shiko. Unahase ngachili kwachi wa kumsongo wa kolera kuhichila mkuna meya kuwa na kuhaka vitumbo nawa aze ali na majilo. Kulia vyakulya na mawoko aze ali na majilo chipwe kuzachisa malonga na jindeho ja kukosa na meya majilo akuhona kuhaka vitumbo. Kulia vyakulya vyakuhona kufika vize vana wili kubajiji. Kulia vyakulya vituta vize kawatumbikanga kana wako. Kulia vyakulya vize vana kulandulula mumikwakwa. Na kulia na wamihako na makovu ako na kukosa kanawa. Tunahasenga chili kulikinga kumusongo wa kolera. Telekenu meya enu akunwa chipwe kuhaka mo vitumbo vya chlorine. Sanenu kumawoko enu na sopo chipwe na meya kuhaka vitumbo hanyima ya kuzaisa chimbusho. Zumisenu vyakulya venu shimbukanda mubilie. Fwikenu havyakulya vyenu vyosena kuchina kuviwila kubajiji. Kanda kulya vyakulya vyakulanda mumikwa kwa nduma. Zachisenu chimbushu lwalo sena. Kahakanda kuzachisa ndundu chipwe mapepa andundu hakuya na kulihehwa nduma. Mwatela kumona ngwenu vipi yosena munavitapwila mchimbushu. Chimbushu chanu nawa chatela kupwa cha unyoji kahanawa cha kufika lwalo sena. Mujimbu uno vanamnehela wakuli vakachanda chatala kulikangula cha meno ya watu cha Ministry of Health.
In Eastern Province, a civil society organization has embarked on training 30 community-based distributors of non-specialized farming planning services in Vubwi, Katete, and Chipata districts. Chisomo Community Project Executive Director Annie Chiseni says the initiative is in a bid to complement government efforts in increasing access to maternal health services in rural communities. Meanwhile, health personnel have thanked the project for the gesture, calling on more organizations to support such ventures. And finally in the news, the Department of Social Welfare in Mpulungu District, Northern Province, has procured 208 bicycles for community welfare assistant committees. District Social Welfare Officer Brian Chile says the bicycles have since been distributed to all the 81 CWACs in the district. As we end the news, we take a look at the stories that made headline. Health sector records positives in 2023. Constituency development funds utilized prudently. And government to construct 28 dams across the country. On that note, we end Zanis News. On behalf of the entire news and production team, I'm Alice Banda saying goodbye and Happy New Year.